October is Breast Cancer Awareness Month, and Dr. Akiko Chiba is a breast cancer surgeon at Wake Forest Baptist Medical Center. She joins us now with more. Good to see you. Thank you so much for joining us. We appreciate it.
Thank you for having me.
All right, so first off, what advice would you give someone who's been recently diagnosed?
So breast cancer diagnosis is very stressful, but what I want my patients to know is that because of the screenings, we catch breast cancer at very early stage and it's often treatable. The other thing I want them to know is that each patient and each breast cancer is very different. So I do recommend them to meet with their breast cancer physicians and find out more about their breast cancer and possible treatment options.
Okay, so let's talk about options out there for someone who's been diagnosed.
Treatment for breast cancer is surgery and also maybe radiation and also chemotherapy or anti-estrogen treatment. So for surgery, lumpectomy is one of the options where only portion of the breast is removed where the cancer is. And in that case, patient also will be recommended to undergo radiation. The other surgical treatment is mastectomy, where the entire breast is removed. And in that case, radiation may not be necessary. And for patients who do undergo mastectomy, reconstruction option is possible, and it can often be performed at the same time as mastectomy.
All right, so let's talk about genetics. My sister was recently diagnosed. Does that predispose me in some way?
So about 5 to 10% of breast cancer is related to genetic mutation. So someone who does have family member that are first degree, which means your sister or mother or your daughter, those people are at increased risk of getting breast cancer. And what's important for someone who's diagnosed with breast cancer at early age, meaning before the age of 50, and with strong family history, we do recommend genetic testing. And depending on the test result, we may offer different surgical options.
All right, so now is there any new research or treatments out there that you are excited about?
There are a few clinical trials that we do offer at Wake Forest Baptist Health, and some of the treatment that I'm excited about is neoadjuvant treatment, which means that patient will get either chemotherapy or anti-estrogen treatment before surgery. And what's exciting about this type of treatment is that we'll be able to shrink the tumor to smaller size so we can do smaller operation for the patients.
And talk a little bit about where people can find out more information.
We have a website, wakehealth.edu is a place you could go to get more information.
So if you suspect something wrong, we should immediately talk to your doctor, right?
Yes.
All right, good deal. Thank you so much. You're awesome. We appreciate it.